So I'd like to call the meeting to order. Could we stand for the pledge, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Sir?
I do, but.
I think she's out of
Here with my friend Frank.
So has everybody had a chance to review the minutes?
Yes.
Okay. Need a motion to approve?
I'll move this.
Second?
I'll second them.
Second? All in favor? Say aye.
Aye.
Opposed? I just want to make a public statement to the committee. And thank you for all your hard work this last year. I'm sure that Jing Chang will be reporting on our health rankings. You know, people have asked me a few questions about it, and I don't think that a lot of people in the community understand the importance of what took place there. We moved a mountain a couple of inches. It's not very far, but we haven't moved the mountain in years, and now we've done it. But it's such a huge collaboration of community efforts. Mr. Broadwell, when he and I talked about this committee, wanted to make sure that we were doing that. We were doing the outreach. We were involving other people. Mr. Rehill with his poverty task force. A lot of other agencies are involved in supporting the health efforts. This is one of those mile markers that when we talk about companies wanting to relocate to Oswego County, you know, getting the health rankings up does that. So I just want to congratulate the health department and tell you how much I appreciate this committee and the work that we've done, the conversations that we've had with the health department to keep them engaged. That's not a small task. We jumped 2 notches. That's phenomenal for us. We set a last for years, and now we're up a little bit. Okay,
I'll throw one thing in for you,
go ahead.
is that for yourself, you came up to our area, Heshar, and told us how big the bathroom should be and how the doors should be changed, which made more room into the bathrooms, which sounds kind of like, huh, what? Made a big difference. One's done, the other one's gotta go. But just people like you or even Dr. Tunchang giving us an idea here and there now and then what to do to help out made our facilities that much nicer for everybody, more handicapped accessible type stuff. So
They had their luncheon Saturday, didn't they?
that we had last Saturday, we
Last Saturday, yeah.
had a meeting, yeah, once a month. But just the way that you had suggested the doors, rather than open, have them slide, makes tremendous amount of room.
It's extremely challenging when you walk into a historical building and you try to keep the integrity of the building and stand there and look at somebody that's counting pennies to make sure they can keep the utilities on and say, not only do you have it wrong, you're not even close. They literally stripped it down to the studs and redid that bathroom. They took everything they could. They were gonna do both of them. They're gonna do the other one in another year or so. But
And you,
I
and
gotta
it
come up and
was
see it.
you being in a rise, right, that
Yep.
you brought that up. So that's an important part of the health department here.
Thank you. So we have a whole list of one resolution,
Big one. Okay,
okay? So resolution 18-1, there's a vacancy, and this is for Dr. William Buckley to join the County Board of Health. Do you have any
I'll move
comment
that.
on that?
He was my
Yeah.
witness.
He's with our Board of Health for the past 6 years. This is renewed because every 6 years we need a renew. And he is the only dentist in the board.
Okay, Margaret, move it, do I have a second?
Second.
Second. Any discussion? Yeah, Frank?
I don't know Dr. Buckley, and it really isn't, it isn't about him, okay? It's about the fact, I believe at the last Governments and Courts meeting, Legislator Del Conte asked the question of how do individuals that may want to be involved get their name into the stream of being able to be appointed or looked at to be appointing to all the boards, because we've got a bunch of them coming up in, I think, just about every meeting that we've got this month. We've got appointments and reappointments, stuff like that. And we're just, myself, I said, well, let me ask a question again at this meeting, because one, I do know, one dentist I think is very excellent, okay, but, I don't even know, where he's from or what he does. He's stationed in Fulton, but how do people find out about the appointments to the different boards, is what I'd like to know at some point in time. I mean, I know you're not gonna be able to answer the question now, but just if somebody would put it in the back of their mind and say, look, maybe we should put, something out there for all the legislators to know about, that we have somebody, an opening coming up, a reappointment coming up. Do you have anybody interested, or somebody that you would like to, put into possibly filling the position? Please let us know. So that's all I'm asking. That's all, because I'm in favor of whoever we put up. But I just want to know.
I got a partial answer for you. Legislators are interested in knowing what's coming up in advance because they might want to talk to people. The clerk of the legislature has a master book of all the advisory councils that has everybody on it and when their terms expires. If you want to take a look at that, it would tell you ahead of time when appointments are coming due.
Okay, all right. Thank you. Good answer.
I'm gonna vote on this and then I'll comment because it's off.
Any other discussion on this? All in favor, say aye.
Aye.
Opposed? Thank you.
Because it's on the same thing, if you have a comment.
Yeah.
Last year, while I was chairman, we pulled out a lot of those committee books, and I would ask that we follow up again with Chris Jones in the office, because we see frequently these renewals, but they need to, we don't even know minutes. We don't see certain things. I guess my point is, there's so many of these subcommittees that were created historically over time, probably for great reason, or one way or the other. Some of them had missions that probably should be reinvigorated. Some of them have died. But we sent out information that should be followed up on, just to say, we would like your minutes, we'd like terms, because we don't know, truly. And they keep coming in front of us and we say, who and what, and have they even been there? And you don't even know, how do we, I guess, so I'm on the same page with how are we making a decision? And a lot of times, we didn't even know if they had, we didn't even know that people expired or terms had expired a long time, that it was our role to try to replace until we get minutes and updates and stuff like that.
Well, I know that the clerk Jones is compiling that, and it's actually at the top of my desk in there, the list of committees and things, expiration dates, and things of that nature. He has reached out, I believe, to all the committees to find out, hey, what do you do? Where's your minutes? What do you need? What was the outcome? Blah, blah. So it's an ongoing thing, but to Frank's point, it should be ongoing.
She agrees with you. Do the Board of Health minutes come back to anybody other than,
Board of Health, we have minutes, and every meeting since I came here, at least I know, we have minutes, and I'm not sure we put on county website or not, and but yes, we do have.
maybe if the committee's that interested, when they email the minutes,
Okay, I will.
we could include the committee members of the health committee.
Okay.
And then if there's an interest beyond that, but it would be the health committee that would point people to that.
Your stomach or the dog?
Is the dog upset with Jim or what?
I don't think she likes a reporter.
It's all a politician's dog.
When we get into the health rankings conversation, I think it goes along the lines with, I believe that someone from the board should come and even sit with this committee. And I'll get into that conversation, because when I was chairman, I went to a board of health meeting,
Yeah, you did.
and there needs to be some better cross collaboration.
Yeah.
period. Like, so someone should come, I don't care if it's once a year, head of the Board of Health and have a goals discussion with this committee. It's that important.
Does everybody understand the Board of Health and what it does? Don't be ashamed if you don't, because that's exactly what I think part of the issue is. But they've got a lot of authority. It shocked me how much, I mean, they condemn houses, they do a lot of work, and it's all for the public, all for the public good. I think that's an excellent suggestion. Yeah, when we get into the
We should, yeah, we'll give them.
Okay. That is it for resolutions. So we're, compliance report. Are you doing that?
I sort of am,
You
yeah.
sort of am? Okay.
And you know, I didn't start till the end of October, so most of the stuff is not stuff that I myself did.
Oh, I love that.
But, I did do some of the ongoing stuff that I learned like the end of the year for, you know, background searches, that kind of stuff. The other major accomplishments are stuff that Linda did while she was here. So I don't know if you guys had a chance to look over it or have
Yeah,
any
we've had it in the
questions.
packet. Is there anything that you would like to cover as highlights, or anything would you like to cover?
Jim Chang maybe, 'cause I'm not as familiar with what was going on last year.
Okay. I think you know, for the past several years, and the compliance work and doing very well. And let me skip how well it was, and really the position compliance officer sitting in health department, but actually the work is throughout the country, all departments. And I know the key things I feel very happy in the past several years is really Linda every year did a training and distributed this training to DSS, because DSS related to jail and HR and county attorney's office, and they let them covered. And if you want me say, for the county's benefit, I really hope things not end at the health department, whether we can build up a mechanism and see where the other department go through, get these things through. Because if anything happen, the fine from the federal government will be very, very heavy. This is honestly, it's always when Linda here, sometimes I will joke. Last night I woke up, cannot go to sleep. I don't know. Yes, this training, they all file with HR, and this is my concern. So I hope really this committee can work with us and make sure every department in the county gets through this training, make sure our county is well covered. Because when even small things screwed up, federal government can come here, make a bigger fine. And I'm very pleased, and Jeannie came here, and she came from a private service agency with a lot of experience, and I really look forward we can keep moving things, doing better.
We're working on it. Learning the stuff that needs to be done, and then we'll expand from the basics from there to more proactive stuff.
I just want to make a comment, and I don't understand all this, but one of the factors that we have a lot of the events in this county. I mean, where our position as a county is tourism and all these events that are taking place, which puts more burden onto the health department, such as the races and different events. I want to congratulate you, you've done an excellent job, and because it's got to be difficult. It's got to be difficult. And without you, we can't have events and things like that, so.
Without music inside.
Okay, so traditionally, we do a motion that we accept the report so that we've let the health department know and on record that it's been presented to us, because that's part of their mandate, right?
I'll make the motion.
I'll second that. I read through it last night. just was looking at the stuff that's being done and going to be done.
Mhm.
Amazing. In no particular question, we'll hear, I'm sure, all the way down the road, whatever. But, yeah. Mhm.
Any further discussion? All those in favor say aye.
Aye.
Opposed? Very good. Okay, Chief, you're up.
Okay, it's my show. I like to use this screen as much as possible instead of print out a lot of things. And today my report to you two parts. One is department activity, and the other is two national survey about related to Oswego County. Okay, and where's the full screen? Here. Here now.
So I'd like to let the members of the committee know, since we always never seem to have an
Okay.
issue with this,
I
if you have
didn't hear.
questions, please feel free to direct them during the presentation to Jane Chang. You don't need to come through me to ask the questions.
But the only question,
So
the only questions I have is on all these charts. Is that what you're gonna?
yeah, I will
That-
I will do that.
Yeah.
And first, our department updates, I will put very briefly, quickly. And this is the picture, and our county is one of 5 counties in the state to get immunization award from state immunization conference. And yes, one is in blue is state staff, and the other two is our nurses. And we're very proud of it. And this really our preventive program, preventive division, they have done a lot of great job.
Is that for flu or
No,
children?
for
Children.
it's more general for innovation, because we still go back to Mr. Karasek said, yes, we need a collaboration, and our collaboration is work with school, work with
Okay,
summer camp, and deliver shots,
kids.
yeah, to kids, and convenient for parents, and really increase people's awareness. So this is our innovation award. We got it. Okay, and the next slide is our hospice program. Our hospice program stated health department announced our team as public health works honor roll. Every year they have this program, and this time, yes, we put our this hospice team there, and hospice really they have done a very good job, I should say, and we saw patient volume increase, and but still our challenge is we don't have enough nurses. We still have difficulty to recruit a nurse, and now, yes, I think barely we can meet them, and now our census is around 20 and above. If we're close to 30, definitely we will have difficulty. But on the other side, I want to say really is our probably baby boomers aging, and our volume probably, yes, will keep going up. I look at, and so difficult is still there, but I think yes, we need to honor them, and really they have done a great job.
Thank you, sir. Is hospice house helping out with the, let's say, overflow or?
This Anthony House, I know last year, and they proposed, and this proposed probably paused there. We don't know exactly what's behind it. Sounds like a pause there. Yes, Anthony House. I think yes, 2 ladies came here,
Yes, that's
made
correct.
presentation last year.
Yep.
This project, at least we know pause there. We don't know cancel or not.
Uh-huh.
Pause there.
Were they having trouble with location? Because I heard they're shopping in Granby.
I'm not sure, and I checked with Vera, and Vera told me she say yeah, probably, yeah. We don't know specifically for what reason. We haven't heard from them for a while.
What's that?
And about our department, and we had our first rabies clinic, and the rabies clinic volume as usual, and over 200, not to reach 300, but this early year of the season, and runs very well, and I want to compliment central services, and because this is the first clinic we don't have Stephanie and John, and Stephanie and John passed the skill technique to new staff, and we still use this electronic certificate. This make the program very, very smooth. I was not there, and because end of last year I was out of town for a national conference, and when I came back, first thing I went to office, asked how's the clinic last night, and they said, oh, everything's good, and so IT Central Service really helped a lot, and I want to compliment them. Hope you, yes, deliver the message. It's really, really good.
So the numbers are down a little bit because you weren't there to sign autographs?
Probably, yeah. Numbers as usual, because first early season, it's always a little bit between 200-300, and the last one lower, but in the middle, I hope summertime we can reach over 300.
Good.
Yeah. And another thing I want to report to you, still related to collaboration, community collaboration is really, our department, health, public health educators, they're certified to do chronic disease training, and chronic disease training, and usually we do with this senior housing project, and to go there and help these seniors. This time we expanded to work with Farnham Family Services, because a lot of people they're addicted, they have many chronic issues, and we tried, and Farnham, they're very open, and yes, let's see how we can expand the service to help these people quit the drug, and really it works. And this is a 6 weeks session, and the first 3 weeks, and the people engage there from first time all sit there, and some even put a hood on. The second time take a hood off, and the third time without sweat, and just keep talking, and the people engage there. And this really, I think this is very good. And Farnham, we do 6 months, and then they will have 6 weeks, and they will have another 6 weeks, yoga nutrition 6 weeks, and then we will go back. So this way our staff not too burn out, and we community collaborate, and hope we can make some small changes. This is about our department brief updates, because other things is still a lot, and I think let's if you have any question, ask me.
Well, I just wanted
Otherwise,
to comment, the chronic disease called CDSMP, it's a phenomenal program, and more employers are getting involved in that. Arise is gonna make that mandatory in all of Valley County, that all employees take it. I'm a master trainer in that, and I constantly have to turn down opportunities outside of the county from other areas. So it's great that employers are finally catching on to this and bringing that into their facilities.
Yeah.
Because it is good training.
Yeah, and especially, I think if you think about these Farnham's clients, yes, they it, and they also have other chronic disease and help them. And they really change from not engaged, not interested to actively participate. Yeah, and we will see how this will attribute to their outcome. Okay. So let me go to our two county reports, and this is county health ranking, and I think yes, you are familiar with this, and almost every year, no, yeah, exactly, not almost every year, we always talk about it, and you can see this year we have some improvement, and as you know, this health ranking divided into health outcomes and health factors. Health outcomes include length of life and quality of life. Quality of life usually is self-reported, and they did through a nationwide survey by CDC, and you can see the red is overall added length of life and quality of life together, and this red line, my pointer cannot work, and this line, and so you can see overall is increase, and our quality of life still, yes, around between 40 and 55, and our length of life increased quite a lot. But still, I want to say, if comparatively stated, because let me go back a little bit, is this length of life, they defined death before 75 years as premature death, and so this our county premature deaths still every year we lost like close to 2,000 years for the whole community, but we improved. Still long way to go to a very good condition. So this is health outcome. I know most we are interested, very interested in this health factors. And health factors is a red line here, and the five contributes there. And health behavior, clinical care, social factors, and physical environment. And when I plot out this graph, one thing immediately catch my eye, and I feel a little bit excited, and I really call it when newspaper interview me, I say yes, I hope this is a turning point. Why? Is because if you look at it, we have 62 counties in the state, and so 60, 61, 62, or 61, 2, and they are bottom three. And this is survey or study started 2010, these 2 years, and this is the first year. None of the factors is on the line 60. We're left at the bottom three. So this, I hope, really, it's a turning point, and we can start to move things up. And you can see, yes, like our clinical care is still always the best, and this light blue line, clinical care, and our socioeconomic factors improved, and our health behaviors also improved. So I try to look at how we make this health behavior change. What works with our program, and really this ranking, it's very tricky, and it's very tricky, and I think we look at it. I try to divide it into smoking rate, obesity, drinking, and STD, and it's still, I go back to, I said so many times, it's so hard to change people's behavior. Smoking rate still the same, slightly under 22%, compared to last year. And drinking, this excessive binge drinking, still around 24%. But our obesity rates, adult obesity rates, no, sorry, rates is increased, but our increase rate lower than other counties. So in the county, our ranking is improved. Last year, our obesity rate is 30. This year is 32.8. Increase is not good, but if you look at the ranking, because other county, their people become more heavier faster than we are. So our ranking improved 7. Okay.
Trying to get our number up.
So we start with you. And also, STD is a big jump. STD is a big jump. And STD, our STD rate reduced close to less than 100 among 1,000 population. So this, I quickly look at, and really, if you look at it, because this ranking and our ranking, smoking is the same, our drinking is the same, but our obesity improved, our STD improved. That's why our health behavior improved, keep improving. So this, at one side, is really, I want to say it's really hard to change adults' behavior. That's why I feel yes, we put our focus on children and healthy highway program. Really, I hope in the long term, our county, yes, after 10, 15 years will be better.
Genshin, do you know what goes into the determination of the physical environment? Because that's one factor I've always been sort of suspicious of in this, because it swings wildly back and forth every year.
Yes.
But really, our physical environment doesn't change. So how does that, what are they counting in there? Or is it a change in methodology from year to year?
The reason, yes, this exactly is because this big up down is because they change their indicators. And I forgot what changed. And they in the past they measured, but still now they measure is how many parks facilities among 1,000, 10,000 or 100,000 population. And now recently they add is gym. How many gym per 100,000 population? And this number in Oswego County, I say yes, it's always our disadvantage because Oswego County is the lowest gym density in the whole state. If this rate put into New York City, probably New York City only need 12 gyms. This is the rate. So this is our disadvantage. And in the early, we are very good, and they include some water, something else. So that's why we are very good. So that's why over these years, bigger change is their major changes.
So generally, researchers, though, when they change their method or their indicators year after year after year, it makes that factor's year-to-year comparison less meaningful.
Yeah. But their health behavior, their clinic, it's very stable.
Okay.
It's very stable.
Thank you.
I'm less concerned about the ones that are in the 40th percentile, like physical environment. And I guess this goes back to last year. Jim was new to the Board of Health as chair of this committee. As chairman, we went to the Board of Health. And that's where I want to go back to that conversation where we just approved a dentist who's plugged in to the system a lot more than we are, right? The people who are the Board of Health are physicians, ex-physicians. They're on, possibly the board of the hospital or other things, a lot more than we are. And it always seems that this committee, to me, I'm always puzzled, because the county health rankings, it says, and I think we spend a lot more time talking about these health rankings than the Board of Health does. So my point is, I'd like to bring that conversation together here so we can have a collaboration and understand what the Board of Health is doing, because we beat you up on these all the time. We always have these conversations. But when you dial into the even deeper detail about the deeper detail
I think it was a conservative vote.
of length of, the real things that are affecting our overall rankings, and you get into length of life and that premature death, that's a bigger conversation than I can have, right? I'd rather know what the Board of Health and what other partners who else is collaborating about the really defined things, because I think if you broke these down, there's some that are killing us. And it's not just the excess drinking and smoking, but there is that access to exercise opportunities. It's little things like that are only 68% when statewide is 93 and countrywide is 91. That seems like something that we could probably tackle and say, is this our planning or Board of Health or other people can collaborate? Within these things, I think there's significant rankers that are affecting this thing that I'd like to know how do we target those? Remember, last year we had a meeting and we asked to get a lot of not-for-profits together to talk about health rankings, right?
Yeah.
The outcome of that, after lengthy conversations, was trauma-informed care was going to be the major focus. Am I right?
Yeah.
Is that still a focus, trauma-informed care, or should we be further breaking down a few of these rankers and wonder specifically with regard to, STDs, how do we keep getting better at that? The child mortality piece, significant rankers that are killing us, that make up those health factors, health behaviors. So that's why I'd like to ask, whether it's the chairman or the Board of Health, because I think this has to be, I only say this because there's 5 people on this committee that won't be here next year. So I'm just saying the rest of this year should be setting some goals or policies that could be helping you for the next 3 years, and coming out of this conversation, working with the Board of Health that continues to focus on these things to improve. And it's not just a burden on you. I'm just saying, when you take the county employees that are in your department versus Oswego Health, who maybe, or whoever else, I think it's a bigger conversation than just the county health department.
Still, go back and I'm still strongly supporting this trauma-informed care. The reason is really trauma-informed care help in the long term. We cannot see effect immediately. In the long term, we can improve our families, improve our community, and eventually improve health. I leave this aside and we can talk.
Well, that's fairly new.
But
Shane, he's absolutely right. I don't think it's trying to pick apart any particular piece of it. It's how do you put together the rest of the conversation? You go to the Board of Health, and they've got, we spent how much time taking care of 2 houses that had bad septics and didn't really have a conversation about where some of the rankings, and you did the same presentation with them that you've done with us last year. So they're aware of it. There are a lot of things, your healthy highways, you're right, generational is gonna change this. And you're not gonna change everything every day. I got, people made a joke of it, and I did myself a few months ago. I said I read the obituaries to look at the age, and I still do that. And I see a lot more 80s, but then you see a 32 thrown in there today, and that skews us. We're a rural county. We're not gonna build gyms up in Williamstown, but how do we provide that kind of is there a program there that the school could run to say, we're gonna have a yoga night or a track night or something like that? I don't know. I think we're on the right path, but
about this deaths and our short mortality, and really a bigger portion of our additional deaths is because of tobacco-related diseases. And there's cancer and OCHD or whatsoever, and obstructive respiratory disease, COPD,
And there's drugs.
like this, yes.
there's
And
still use.
another thing, yes, last week, most of the time I was out of town in national training, and really, suicide. I learned at the conference, because we talk about suicide and in a small session, and teenage suicide, farmers suicide, and firemen's suicide nationwide. It's, yes,
Did you involve?
so
I do, it's-
like these kind of factors contribute our premature deaths is high. We are a rural community, and our another challenge really work here is really, I talk with people and they can find out in our town, in our county, how many people suicide. I say no. We look at the back 2-3 years, and people knew, yes, so is suicide. But if you look at the death certificate, none of people in county suicide, because usually, yes, families say no, don't put it there, and just to say drawn, just to say accident. Even some doctor you put yes, cardiac arrest. This is the definition of death, not the cause of death, but this is our challenge. But yes, definitely, I'm going to bring this. Friday we will have health committee board of health meeting. I will bring it. And as for what to do, yes, we need to promote health behavior, and we need to promote healthy living. And before I went to the conference, I met with YMCA. I'm going to start with Oswego YMCA, and we will work with them and find some project, health eating, health behavior, and start young and see how things go, and then expand to see and build up a community partnership. This is my answer to you. Definitely, this will bring to the board of health.
Okay, Frank, here.
There's just so many things that, we talked about this since the beginning. It's, goes back to, and we're concentrating on children in schools, okay? But they're only in the schools for 8 hours a day. Some of them are only in schools for 2 hours a day. You don't probably know that. But all ed kids only go to school for 2 hours a day. And that's because they can't function proactively in a classroom with the other students, and therefore the parents of those students that are acting rational don't want those kids in the classroom to disrupt the teachings and the learning of their children. So they only go 2 hours a day. So the rest of the time, they're in their family home. And I'm just telling you, from dealing with and driving alt ed kids, or even, the regular students, there's so many of them that they get on the bus. And I will not say names or anything, okay, but I'm just telling you, some of those students get on the bus, and it takes a good hour after they get off the bus for the smell to get out of the bus. It's because they're not doing home hygiene. They're putting on the clothes that they like, that have been sitting in the hamper for 2-3 days that haven't been washed. They're not taking showers, okay? In Fulton, you've got the YMCA. In Oswego, you've got the YMCA, where they have programs for the kids to, to go and do things. But who wants to be on a wrestling mat with a kid that doesn't smell good, okay? And what happens is, because of that, they get picked on by other students, and therefore they act out, and therefore they get thrown into the alt ed. Now, are they naturally anger, management people? No, they're not. But you're not gonna sit there and, a kid's not gonna sit there and take being picked on about, smell, and that's all he knows. He doesn't know any different. And that's where the change has to come for us in those senses. It's hard to say, okay, this is what we're gonna concentrate on, because it's, with us, it's everything. The baby boomers, I went back to the first year I was on this committee, and I said, we used to have health class every day, because we go into the teacher, and the teacher would tell us, put out your fingers, they check your fingernails, and she'd say you'd get a star if you had clean fingernails and clean it. So kids were in tune to, they had to make sure they wanted to get that star when they went in to school that day, because the teacher would look at their hands and, behind their ears or whatever, and they would get a star. Well, now, and I know that there's a lot of people who can throw this back on, a lot of liberals, but they're saying that, well, you don't want to embarrass the child. And that's why they don't do that anymore, and they don't perform those things. It's hard, because we are setting them up for a problem later in their lives. And what we're doing, we're helping, and hopefully out of maybe 50 kids that we deal with, maybe 10 of them will get the right idea when they go on. So that's 10 that we won't have to worry about their kids being, in a situation where they're gonna be picked on, or they're gonna be, put our numbers down, okay? That's what we have to look at. I mean, I see it day in and day out, and it's not good. And one issue that I have with the Board of Health is, at the county level, is people ask me when I go to, a meeting, and they say, well, somebody says, well, what about this house that doesn't have any heating, or doesn't have any water, or doesn't have this, doesn't have that? And of course, the board, the common council said, well, that's a county issue. I said, no, it's not a county issue. I said, because I've taken it to the county. This is a county, it's a city issue. It's your, issue. You have to deal with it. If you want the county to come in, you have to ask them to come in. You can't just, we can't go to the county and have the county come in here and take care of a house that has children in it, that is getting DSS support, but yet they don't have any water and they don't have any heat. And there's nothing being done. And they say, isn't the house condemned? No, it's not. So, our health committee and our health department, I think, has done, has done great things. And I wrote about it on social media, how proud I was to be a member of this committee, that the rankings have gone up. You and I talked, the first year you talked, you sat in here and you said, I can't believe that we're at the bottom of this ranking. Yep. And we're sitting here, and what are we doing about it, okay? And that was 6 years ago, okay? And now we're moving up. It took us 6 years to get there, but this man and his group got us there, okay? And our holding him accountable made it happen. Okay?
Go ahead.
That's it, thank you.
Appreciate that, but I guess to dial it down a little bit, so when you look at something that's a heavy ranker like adult obesity, right? So we made a decision here, it started here with the Healthy Highway Program, right? Created, that turned into a partnership with Oswego Health,
Yeah.
right? So, and the schools. So now we're talking the youth long-term, hopefully changes. My point is there's probably a couple other things, and if it's trauma-informed care, and that's going to be a long-term thing, great. My point is, what else now?
Collaboration.
So
Sorry.
If you took one more of these things, one more, and got everybody in the same room and said, what's the best way to look at that? Because that's really hurting that number.
Okay.
I just think that needs to be thrown on the wall now. And with the Board of Health to say, get them to the table, because they have a lot of power from that committee.
I will go back and look at all these details, just like I compared obesity, STD. Let me go back and I will bring back.
Let me,
All right.
one other comment is this, because it was brought up a long time ago, is also when you get into teenage birth, right? Teenage pregnancies.
Yeah.
And I have a son still in high school, and I know a lot of the counselors, and they'll talk about, if you knew now how many pregnant teenagers were in schools or already have multiple children, it would blow you away compared.
Yeah.
So I have counselors that I graduated with were there and said, think about when we were there. And if there was one or two, that was a big deal. It was a big conversation who were pregnant then. It's a normal part of the conversation today with what's happening. So it came up years ago, and if you recall, Legislator Schott even brought data in professionally from around the country to talk about there are incentive programs to have that conversation with teenagers. So I mean, I think we need to start to get aggressive on a few things and collaborate and bring back ideas like she had that just went by the wayside. So I'm just, this year, I think we really gotta just turn up the gas, man, and we're all here to do what we can.
To go back to the original that I said at the beginning of the meeting, and I like the analogy of it. We moved the mountain 2 inches. And we're at a point we haven't been at since I've been a legislator, that we see an uptick in everything. And I think your point is exactly going to be the next thing is what's next?
Yeah.
You know, we gotta continue what we're doing, but how do we move the mile marker even further? So I think, and being on the Board of Health and listening to that conversation and on this, I think it's a great idea to have that tie together piece.
After this meeting, yes, I will dive deep on this data, and next month I report back to you and what's my finding. Okay, and but Mr. Broadwell, very, very, very specifically, I wanted to bring this teenager pregnancy. This topic in so frequently happen with my preventive nurse. And the challenge here is not just we put long-term contraceptive things to them. The issue is really so many times I heard from our nurse is these young lady, young girls, they want love. And the community, the family situation, just like Mr. Castillo said, they grew up without love, without hope. This is the issue, and some story really I don't want to say in this bigger group, and these are issues, but really still go back, and I hope we can keep trauma informed care. Start these kids young, give them love, and keep going. In our community, another thing, our department start to engage in, but it's very, very good, is imagination library. In our county, we have 9 school district, and now it's already promoted to 4 school district. Eventually, we'll go through all 9 school district. It's a foundation by a big celebrity singer, female singer. And, you know this, I don't know yet. And start kids from 0 to go to school 4 years old. Every month, a book mailed to the house. And let baby parents guardians read to them, and this way improve their bond, make them be school ready. This is still related to Mr. Castillo said about some kids they don't want to learn. Yeah, this one teacher in a video, she said a third grade kid can only read several words, cannot read. Third grade teacher want to read. No, I don't know how to. So this is really so many things, and I think yes, still go back and we collaboratively, and I'm willing to work with you, work with Board of Health, and expand our collaboration, and yes, change our community.
Morris?
Yeah, I agree 100% with Jamie on this. And that, once again, I don't understand how, there's a lot of organizations in this county that are working to do similar things, such as OCO and things like that. I just see there's an opportunity to not put all the load on the health department by any means, but they should be OCO, and they're capable. A lot of their programs that go out and do these things, they're in the different homes divisions, they're in different places, they're different programs. And I know that the responsibility is not all yours, but how can we get this working to do what he's talking about, what we'd like to see with all these other organizations? And Jim, you know much better than I do, how this can somehow fit.
Some of that's taking place, and we just haven't had a chance to let it run. The fresh food truck, I mean, that's a new program for us. It really hasn't had a long time. I had a talk with the superintendent of Fulton Schools the other day, and I asked him how the feeding program was going. Fulton and Hannibal are the only two that have free lunches for everyone, no questions asked. They get fed. And he told me that they have found they had to make a major adjustment in their menus because they were throwing food away. And he said, so now we're making adjustments and we're finding that they're, it's more nutritious, but it's the stuff kids want to eat. But it's too soon to tell if that's going to have a big impact or not because it's brand new. And it's not countywide, it's in two districts, so.
I just added that two things on Jim's point, because I was there. Do you remember the first year when you were here and you said, we got to find out what Fulton's doing good up there because they had so many people on the nutrition program up there. And I said, we better check with Fulton because they're throwing the food away. All right. Now, yes, in Fulton, somebody in Fulton was all proud that Fulton was on getting free lunches for everybody. Well, I'm sorry, you've got to look at why they're getting the free lunches. It's because the poverty rate in Fulton is so high that they qualified to get it for everybody. That's why they're getting the free lunches. But to go back on what Morris is talking about, we got all these organizations, and I'm not saying that we don't need them, okay? And I'm not saying that. But if you don't get a buy-in for the people that you're trying to help, all the programs in the world are not going to change anything. Last month I voted no on issues that were giving money to transportation and stuff like that. I said, well, if you're not getting a buy-in from these people that are going for drug treatment and for health issues to pay for something somewhere, then they're not going to go. They're not going to say, why should I go? I don't have to go if I don't want to. That's the way it is in the school districts. The only reason I keep bringing the school districts up is because they are the future of this whole county. When you have kids that are in elementary school, they're alt ed kids. That means that they can't deal in the classroom. I never saw. Did you ever see that when you were in school, Mr. Broadwell? That you had kids that were in fifth or sixth graders that didn't go to the regular school. We have to get a buy-in from the parents. We have to get some way to make them buy in, because we're going to spend a fortune on it, and it's not going to do that. It's not going to help them, and we want to help them.
Okay,
Just to follow up on the schools conversation and why we talk about collaborative. There is a collaborative group, and I know that it's for health, and it's even called they meet at the health department, correct? The
Oh,
collaborative.
rural health network you talk about, right?
Rural health network?
Rural health
Is that the one with
network,
all the groups get
yes.
together?
Many agencies, yes.
So two parts on that, I guess, and this is a part where the schools should somewhat come to the table. You've got definitely now some alignment with, when we did the county anti-poverty thing, which basically now Stu Amell, who has been leading the way, working with the superintendents, helped integrate healthy highways. With regard to what you talked about within the schools, Sandy Creek has a program that was born by them that brought in healthcare and literally washers and dryers through Noxie into the schools. And it's happening also now in APW. It's happening in the smaller schools. The two larger school districts where we see a lot of the impact is Oswego and Fulton those things have to advance faster because it was easier in the smaller schools to get buy-in and get it in, but it's exactly what we're talking about. Because it's smaller, they can recognize the child and they kind of care more for them than they're even getting at home. This is the conversation born by them. So now they want to be in school, it's earlier, pre-K, and it's extending the day. So you got longer durations for those kids in the same environment is exactly what you're talking about. It's just got to advance faster in not bigger schools. And just one more comment, and I don't want to belabor this, but it goes back to the same point. Everybody's talking about these things. It should be that big of a conversation that we take time, because when I was at last year's Exelon leadership meeting we're talking the top end of the people out at the plant and all the elected officials in the room, they said, we need your help. We can't recruit people to come. It's very difficult for them to get the highest paying positions in Oswego, in central New York, not just Oswego County.
Right.
For them to relocate here, and it has a lot to do with those things that people look into, with relocating and putting their kids in our schools and stuff. So
Yes.
I'm gonna keep belaboring this
It's
board month by month. I'm just gonna let you know.
And
No,
that's
it's not a
that's a
blame.
scary fact. I mean, there's another factory, I'm not gonna name it, but, talk to them and they've got openings. And they said, Jim, we can't even get people to pass the drug test.
Yeah.
They come in and, we've got good paying jobs.
Yeah.
And we have several, and we can't get people to pass the drug test.
Thank you, sir. On the a book a month for the child. Once upon a time, I was in the Legacy Volunteers, and we had a father that couldn't read anything, and he wanted to read to his child. So we taught him how to read eventually, but we told him to bring in the child's book every single week that he came in, and we taught him to read that book. So when he went home, he looked like he was reading the book to the child from himself. But in the meantime, the books got a little bit harder, but in the meantime, he was also growing, so he began to be able to read himself. Then when he could read in the mail, the trash that come in the mail, he thought he was pretty smart. He would read all the advertisements that come in, and he really saw himself being able to pick up something in his mailbox and being able to read it without us telling him how to read it.
This is a good collaboration, and now we work with this Education West Foundation and our nurse, maternal child, home visiting, healthy family, yes, promote this program. And we talk about collaboration, and the two things really I learned from the training last week was I was out for 5 days. First 2 days is a training. Last 3 days is a national conference about health behavior. First 3 days, it's a very good mix of people, and 60 people in a room, and then sometimes divided into small group, and 20 people from state and the local health department like me, 20 people from state and the local behavioral health official, and another 20 people from state legislators or state legislative staff, and get together in the room, and we talk about a lot of challenges, like just I learned, oh, it's not just our county farmers suicide are high, the whole nation is an issue, and teenager suicide is a nation. Another thing learned is really, we talk with state legislators there, and because public health and behavior health get together, and we pointed at legislators at the state level, and the state level immediately, yes, refer to Washington DC because of funding issue. And you have money, I have money, but we cannot work together. The reason is because all the money assigned, this money do this money do that. We cannot make. So we need very hard to find out, okay, I got this money for this purpose. You got money close to this, and you got money close to this. Then three of us can work together. Otherwise, we have to do different things. This funding mechanism limited a lot of collaboration opportunity, and they have to do as they do, and we have to do as we do. Sure, comparatively, I feel yes, probably public health we have more leeway, and the other agencies, yes, they are very, very limited.
Okay, so
This
next
is
month
our
you're gonna come back with a couple ideas.
Yeah, I will come back with more detailed analyze.
Okay.
Okay,
And your goal
Eh,
Friday, Jim?
and let me keep moving here. And yes, I still want to show some smoking, our smoking program. Although yes, the big data cannot show our progress, and I updated our smoking smoking program in our county, and this is at the meeting I talk with them and really share this with people, and they're also very impressed, and I updated our program started middle of 2015, and I updated early this year, and still you can see we have over 70% of pregnant women they quit smoking, usually without intervention 20%, and less than 3 months quit, and this 12 months quit, and really we are very high, and compared to other, and the other is still our program serve more people than needed in public insurance than private insurance. This all pregnant woman, blue bar is public insured, orange bar is private insured, and you can see these are all population, and these are people in our program. They finish 12 months smoke-free after they deliver baby. So more private, more public insured women get benefits. So yeah, this is really where it's a in English term, and it's a huge hay, and we're moving needles, but still gradually we move the situation better. But yeah. And the second national survey I want to share with you, and this is a national survey also sponsored by Robert Wood Johnson Foundation, and this is assess community collaboration and health department performance, and this analyze, yes, I send it to you, and you can see. I want to show you here is really, you can see this top right is 2008, bottom left is 2016, and the bottom right is 2014, and they look at the community collaboration, and you can see apparently it's big difference 2016, 2018, and the 2014. The reason you can see, and they put the organization in the three different groups. One is healthcare, community, and the government. And so you can see yellow spot is healthcare, and light blue spot is community, and green is government. And so you can see 2008 and more line connect each other. It's really reflect our community change from 2014, 2016 to 2018. And so this is, and the next slide you can see the left side. The blue line is Oswego County, and the red line is national average. And in the middle, this orange line is in the nation, the same size of like Oswego County average. So national average and our peer counties in the nation, and on the top is Oswego County. So our collaboration, you can see overall, yes, much better. And this study in the nation already 20 years, and I don't know why. And Oswego just started 2014, and you can see our collaboration from under group in the state, around the state average, go above to our peers average. And the other is our health, our county health department. And yes, it's not as good as our whole community, but still slightly higher than our peers. So, all right.
Cool.
Anything else?
That's it. And these are all I prepared. And you have any questions? And really, I enjoy your comments, suggestions, and the next months I will bring more detail here, and we'll have a further discussion.
I just got one more comment. Within your last few comments, we talked about lack of funding, I guess, and collaboration. Really, last year, I felt like we kind of failed with grant writing in Oswego County on a grander scale. I saw the CFA announcements for all the surrounding areas, and I looked at it in detail compared to what Oswego County got. You know, I thought I was on top of it. We clearly didn't succeed like many others did. And there's a lot of social programming, incentives with schools, collaboration. There's a lot of money that got doled out for those things. We hired a grant writer, right, to help us out to do those things and think outside the box. So if this collaboration group with Oswego Health, with these rankings, needs somebody to take an effort from a group and bring it to the county, then let's get her at the table and that group while they're on the payroll month after month and put them to work. You know, so I mean, last month we sat here and you were out to Walmart looking for donations. It really freaks me out, right? On a grander scale, is that time and energy to be focused working with a collaborative group coming out with a grander opportunity to go to find a pot of money to help fund some great initiative? I don't know. I'm just saying we have the tools to do that. And I don't think we're taking advantage of them, so.
Okay, very good. Anything else? Any appropriate motion to adjourn?
Ditto.
Dittoing him or dittoing the motion?
Ditto. Legislative.
A lot of work for us to do.
Motion adjourned?
Motion to adjourn. Second?
No, you can't say that. He's right.
This is.
We stand adjourned.